What are expectant parents who are planning to deliver at Peace Arts going to do now?
Well, they're going to be cared for. I think the plan right now is to go to an alternative site. So usually, for the Peace Arch closures, they're either diverted to Surrey, where a midwife would go with them, like their midwife from White Rock would
Right.
almost certainly be able to go with them, or Langley. It could also be Langley Hospital.
And would they have? I mean, if a doctor has followed them throughout the pregnancy, that it's I guess it's not guaranteed, obviously, that doctor is going to be there.
Yeah, for low risk providers, like if you've got a patient who either has a midwife or a family doctor
Yeah.
caring for them, it kind of depends, right? Like most family doctors are not going to go with their patient to a different site.
Right.
Midwives often have privileges at more than one hospital.
Exactly. And so, I mean, midwives will be there for hospital deliveries and for home births as well. But
Yeah,
so,
yes.
what do diversions like this mean for midwives then?
Well, it's logistically challenging. We're kind of in the middle between the system and the patients. So we're trying to inform the patients and make a plan for, don't go to Peace Arch. Make sure you call us when you're in labor and we'll meet you at the hospital that, we're being told to go to. Like I said, usually Surrey, occasionally Langley, depending on the situation. And then also, consider if a Peace Arch midwife had a delivery on the 18th before the diversion, they might actually have to go to the hospital to see those families and make sure mom and baby are doing well, or birther and baby are doing well. And then also maybe be called for a labor and have to zip over to Surrey or Langley and do that delivery with that family. So logistically it can be challenging, more driving and more just juggling.
And what is it like for the expectant mothers? I mean, when you come to, you arrive at a hospital. What if you arrive there at the same time three other pregnant women arrive? I mean, is there any guarantee the resources are going to be available?
Well, maternity care is a bit like the ER. It's not very predictable. Babies show up when they feel like it,
Yeah,
often in the middle of the night, not usually three at the exact same time,
sure.
but you can never know with these things. So we work as a team, Stephen, with midwives, midwives work with registered nurses, with the other doctors on the site, whether it's family doctors, OB-GYNs. We all work together. And if there's a whole bunch of people showing up at once, it's all hands on deck.
Hmm.
We get it done. We make sure that everybody's cared for and safe.
And I understand you're based out of Royal Columbian, is that right?
I do.
Right.
My office is in Port Coquitlam, and the hospital that I work at is RCH. Yeah.
So that's one of the bigger hospitals in the Fraser Health region. What knock-on effects have you seen or have you heard about when diversions like this are happening at smaller hospitals?
Yeah, that's a great question. When any site is closed, whether it's a short term diversion because the unit is busy, or a few days like this because of consultant coverage, it absolutely affects the whole rest of the region. Everybody is picking up the slack a little bit for sure.
We had Doctors of BC President Adam Thompson on the show earlier this week, and he said that the province needs to invest more in maternity care. And Health Minister Josie Osborne said in January that Fraser Health is working, here's a quote from her, working really hard to fill those gaps. What are you
Yeah.
seeing?
I agree. I think that there is a very concerted effort to hire those consultants to fill the gaps, like this current shortage we're in, or this diversion we're in at Peace Arch, is all about OB-GYN coverage. There isn't enough OB-GYN coverage to cover the call schedule for those 4 days.
We asked Fraser Health about this, and they sent us a statement. And part of that says the timing of potential future maternity diversions is dynamic as we collaborate with our physician group to proactively address staffing gaps.
Yeah.
Occasionally, we must also respond on short notice to cover unexpected absences due to sick calls. Do you have any empathy for the situation they're facing right now?
I really do, because as a fellow on-call care provider, I know exactly what it feels like when somebody sends you a text message at 5 a.m. saying, I have the flu, I can't be on call today. We're scrambling trying to fill those gaps. I work in a larger team where there's quite a few of us. So if one person is down, usually somebody can step up. But if you've got a small OB call group, then and they're a bit thin on the ground, then all it takes is one person being on vacation and maybe one person calling in sick for the wheels to kind of fall off the bus. I really think they need more OBGYNs.
Well, it does sound like that. I mean, if that's the situation where you have one person on vacation and one person calling in sick, that's not that unusual, and you can shut down an entire maternity ward because of that.
I mean, ideally, no, right? Because if there's a big enough team that there's
Yeah.
some redundancy, then, that wouldn't happen. But it sounds like they're pretty tight for staff there right now.
Right. And Fraser Health says Peace Arch and Ridge Meadows are seeing higher demand for specialized OB/GYN care. And it says one of the reasons for this demand is a lack of midwives providing complete care from pregnancy through birth and recovery. Why are we seeing that decline?
Yeah, that's an interesting question. And I mean, one thing I would say, Stephen, is this diversion in particular is about OBGYN coverage. So
Yeah.
it really doesn't have anything to do like with midwifery coverage.
Yeah.
That site has full midwifery staffing, just so you know. But it is an interesting question. There is some decline overall in midwives providing full scope care from like the first prenatal visit all the way to the final postnatal visit at 6 weeks. And the reason for that is probably the same reason there's a little bit of a shortage of OBGYNs at Peace Arch right now.
Yeah.
It's because being on call is hard. It's hard on the body, it's hard on families. And if there's not enough of us, then everybody gets quite stretched, and that can be really difficult to sustain.
Hmm.
And the truth is that being on call is very ill compensated in our system, I think, for all care providers.
Dina, we'll have to leave it there this morning. Thank you so much for the time. We appreciate it.
All the best, Stephen.
All
Thanks
right.
so much.
You take care. That's Dina Davidson, the co chair of the Midwives Association of BC.